Next concept we can discuss the repair. So repair means skin repair. Okay. Repair means skin repair. So whenever we are coding a skin repair, first we need to check the type of material. What type of material they used to perform a repair. Based on the type of repair, we have code. Some suture materials was not codable. Some suture materials only codable. Clear? Use the codes in the section to designate wound closure utilizing sutures, staples or tissue adhesives, either singly or combination with each other. In combination with adhesive strips, chemical cauterization, electrocauterization or wound closure utilizing adhesive strips as the sole repair material are included in the appropriate ENN code. So these materials was not codable separately like chemical cauterization or electrocauterization or strips, like steri strips or adhesive strips. If they used to suture material, it should not be codable suture material. It was included in the appropriate emergency service or evaluation service. Okay, it was not a separate procedure. So no need to code. Whenever we are coding repairs, check the type of suture material. After that, based on the type of repair, they divided total three types: simple, intermediate, complex. Like based on the depth and various techniques, they divided as simple repair, intermediate repair, and complex repair of lacerations. In diagnosis, you will get mostly laceration when you are getting the repair. Okay, laceration repair, skin repair, suture repair, all are same meaning, guys. First, simple repair. Simple repair means is used when the wound is superficial, involving primarily epidermis or dermis or subcutaneous tissues, without significant involvement of deeper and required simple one layer closure. Like here, depth should be epidermis or dermis or superficial layers of the subcutaneous tissue. Deeper layers not involved means superficial layers of the subcutaneous tissue. Actually, single layer closures, okay? One layer only they will use. Simple one layer closure or single layer closure they will use to done the suture. It should be simple repair. One layer closure or simple layer closure or single layer closure. Here actually they will give the local anesthesia and they will suture that wound. Then intermediate means here check the depth, subcutaneous tissue, okay, deeper layers of the subcutaneous tissue, then non-muscle fascia, okay, non-muscle fascia, or if they done the layered closure, required a layered closure. If you seen this word, layered closure, consider as intermediate repair, or two-layer closure, two-layer closure, or multiple layer closure also intermediate. Okay, or sometimes Sometimes single layer closure also we can code as intermediate. Okay. Sometimes single layer closure also we can code as intermediate. When we need to code as intermediate?
Single layer or layer closure or
Uh,
multiple layer closure.
Single layer also we can code as intermediate when single layer closure of heavily contaminated wounds that have required extensive cleaning or removal of any particulate matter also constitute as intermediate repair. Okay, sometimes single layer closure also, if that layer wound was heavily contaminated, they done extensive cleaning or removal of any particulate matter, means any foreign body from that wound they removed. Then also we need to consider as intermediate or two layered closure or layered closure. Okay, consider as intermediate. Single layer closure should be simple. So please read that simple repair and intermediate repair once. Clear? Huh? Simple repair and intermediate repair guidelines. You get idea, right? When we need to code simple, when we need to code intermediate.
Yes, sir.
Thank you. Next, complex repair. Complex means here depth should be exposure of bone, cartilage, tendon, or named neurovascular structure. Debridement of wound edges. Compulsory, they need to perform debridement of wound edges, guys. Without debridement of wound edges, it should not be a complex repair. They need to perform wound edges compulsory debridement. Without debridement, do not consider as complex repair. It should be go with intermediate only. If they're done up to bone level depth, but they not perform the debridement of wound edges, we need to go with only intermediate. So here, up to intermediate required guidelines we included. Additionally, require at least one of the following. Whatever they performing up to intermediate, we need to append here. Include the repair of wounds that in addition to the requirement of intermediate repair. These are the additions. Remaining guidelines should be same for intermediate and complex. These should be addition. Like depth should be bone or tendon or cartilage. And they perform the debridement of wound edges. We need to go with intermediate repair. Clear?
Yes, sir.
Next, whenever they performing the multiple lacerations, we need to code sequence first complex repair, then intermediate repair, then simple repair, guys. So, complex, intermediate, simple. In this sequence, we need to code.
Complex intermediate.
Complex repair, intermediate repair, simple repair. In this sequence, we need to code. Okay, when there is no complex, only intermediate and simple, intermediate and simple. If there is only simple, code only simple. Next concept. Okay.
Okay.
Next concept. So whenever we are
So,
coding the lacerations, any doubt?
sorry, the complex repair ఒకసారి మళ్ళీ ఒకసారి రిపీట్ చేయండి సార్.
Whatever we discussed up to intermediate, we need to follow. Okay, intermediate guidelines వరకు ఉన్నవన్నీ ఫాలో అయ్యి అడిషనల్గా డెప్త్ చెక్ చేసుకోవాలి. డెప్త్ ఆఫ్ ద డిప్ wound, లైక్ బోనా, కార్టిలేజా, టెండానా. తర్వాత వచ్చేసి డిబ్రైడ్మెంట్ ఆఫ్ wound అడ్జస్ట్ చేసి ఉండాలి, అప్పుడు అది కాంప్లెక్స్ అవుతుంది.
And we
Okay.
have to know the undermining also, kada sir?
అండర్మైనింగ్ మతలబ్ విచ్ మీన్
How much depth they are going.
they will
Undermining of
document, right?
formation.
They will document what depth they done.
Okay.
Okay, definitely they will mention what depth of the wound closed. If they not mentioned, okay, if they not mentioned, you need to go with superficial skin level by default. So now we have type of repair, right? Simple, intermediate, complex. Clear? These three definitions you understood, right?
Yes, sir.
Next. So now, after identifying the type of debridement, laceration, we need to check surface area. How much surface area they repaired, like length. Okay. Surface area we need to check. How much surface area they done the laceration. Then location. Where they done the repair. Which location? Okay. Location like hand, face, where they performed the laceration. Three things we need to identify while we are coding a procedure. Type of repair, surface area length, and location. These three things, if you identify, means you will get a code. Now, next guideline. See, guys, here the laceration repair guidelines are based on the anatomical surface area, anatomical group, they divided. Okay, so 12001, what are the body parts you find here? Simple repair of superficial wounds, scalp, neck, axilla, external genitalia, trunk, and extremities, including hands and feet, 2.5 centimeter or less. These are the one anatomic group. In these locations, wherever they performing the laceration, you will get only 12001. If it should be simple repair means. Okay, what? We have two anatomical groups in the simple repair. 12001, 12011. These headings you can put at least 12031, 12041, 12051. Three anatomic groups in the intermediate repair. Okay. So 12001, they given some body parts right here.
Yes, sir. Hands and feet.
Suppose in 12001 also they given some body parts. Face, eyes, ears, nose, lips, mucous membrane. 2.5 centimeter or less. Then 2.6 to 5 centimeter, 5.1 to 7.5, 7.6 to 12.5. Clear? Next, intermediate repair. In intermediate, we have three anatomic groups: 3-1, 5-1, 4-1. 3-1, they given repairment, intermediate wound, scalp, axilla, trunk, extremities. Here, excluding hands and feet, remember, not included. Hands and feet, they given a separate anatomic group in the intermediate. Hand and feet, neck, external genitalia separate. Then 5-1. Repair of intermediate wound, face, ear, eyelid, nose, lips. Three anatomic groups. Then complex repair should be here trunk one anatomic group. Trunk means chest area. Then eyelids, nose, ear, lips. 130, 100, 151 and 120. Scalp, arm, legs. Scalp, arm, legs. Okay. Then chin, mouth, neck, axilla, genitalia, hands and feet. These are the complex, like 4 anatomic groups we have. 110, 120, 1311, 150. So based on that, we need to code which location they done the repair. Okay, well, in main code only they given the locations. Now, next concept. After identifying the location, you will go to the code. When they performed single laceration, like one wound, single laceration, no problem, guys. We can code directly based on the location, length, and type of repair. You will get a code. Suppose scalp 2 centimeter, simple repair. What is the code? Tell me.
12001.
12001.
0. Yeah.
12001. Scalp 2 centimeter, 12001. Suppose 4 centimeter. What is the code?
12032.
Why 32? 12002.
Yeah, 2 to 6 ones.
12002.
002.
Yeah.
Simple repair, na? Suppose intermediate or simple or complex, if they given single laceration, no problem. We can code directly based on the length. Whenever they performing multiple lacerations, we need to cross check lot of guidelines. Here, whenever they perform multiple lacerations, check type of repair and anatomic group. Type of repair and anatomic group check. Suppose first point see sum the length of surface area each group of anatomic sites, which means same type of repair, same anatomic group means we need to sum the length. Same type of repair, same anatomic group means we need to sum the surface area. Okay, we need to sum the surface area if the wounds are same anatomic groups and same type of repair. Clear? 12001, 12002, 12004. Suppose 2 centimeter scalp, 2 centimeter hand. How we need to code? Both are closed with single repair.
12002.
We need to sum the surface area.
Yes.
Okay. We need to
Sum the surface.
surface area. Clear? Suppose. Suppose. Whenever they performed different type of repair. No. Different type of repair. One intermediate. One simple repair. Intermediate 2 centimeter hand. Simple 3 centimeter face. How we need to go?
First we will due to intermediate code.
Hmm?
12031 and 12002.
First we will due to the intermediate code,
Hmm.
then add on simple.
Will code differently.
First we
Will
code
not add.
intermediate and
The
then
sequence is the complex intermediate simple.
Hmm.
So we
First
will
we
first
code
do,
intermediate
first we
and
will
then
do,
simple.
yeah. 12031 and
12051.
120. What is the code for 2 centimeter hand?
12031.
1203.
3 was excluding. Read at least what they documented. 3 was excluding, right?
12041.
12041 hand 2 centimeter. Next, face 3 centimeter simple. What is the code?
12002.
Where it 12002 face was documented in 12002? Face was in
12011.
113 centimeter,
Yes,
right?
sir.
12013 up to 2.5 only 12011. 2.6 to 5 12013, right?
Yes.
Different type of procedure. So 59. Got it?
Yes.
Complete the first question. If you done this question, you will get laceration guidelines. Is the answer? Correct, bro. Are you trying to lead, right? Hello.
Yes, sir.
Yeah,
Yes,
lead.
sir. Okay. ARC, sir. I think so.
ARC completely wrong, bro.
Sorry, sir.
Both are wrong.
I think it's D.
D correct. See why? Because so here how many lacerations they documented, note down and
Yeah.
check.
1, 2.
Yeah, any intermediate?
No, sir. Last all of other wounds are close. Try to complete closure.
One was chin
Oh,
was required layer closer, right?
Intermediate
yes.
repair.
The one on her chin required layered closer. Chin, how many centimeter they performed?
4 centimeters.
4
4
centimeter.
centimeters. So in all options they given 12052
Yes.
intermediate repair code. So no worry about intermediate. We need to check the complex repairs. So remaining how many lacerations we have? Chin, intermediate, leave it. 1, 2, 3, 4 lacerations, correct?
Yes, sir.
So 12.5 centimeter where it happened? Chest. Remaining 8.6 should be forehead, 5.5 right cheek, 4 should be left cheek. Check the anatomic groups.
Trunk is separated and cheek and forehead are in the same group.
Okay.
Clear? Next. Here check all are same anatomic group or different anatomic group.
Different anatomic groups.
Different anatomical group, right?
Yes.
So here see, chest was separate anatomical location.
Yes, sir.
Then forehead,
Forehead.
left cheek, right cheek, same anatomical location, correct?
Yes, sir.
So what is the length? 8.6, 5.5 and 4. Total how much? Sum that length.
8.6, 8.4, 14.1.
15.1.
15.1.
15.1, right?
Yeah.
So what is the 13132 code descriptions? Up to 7.5. 18.1, right? Total?
Yes, sir.
Yes, sir.
Yes, sir.
13132 should be 7.5. But then
7.5. Yeah.
remaining each additional 5 centimeter we need to use add-on code. After 7.5, we have 10.6. So 5, 5 and 0.6 total 3 times. Correct?
Yes.
So 13132, 33, 13101, 13102. Here 1313132 coded both. It should be wrong, right? We should not
Yes.
code 3132 two primary codes, correct?
Yes, sir.
Okay, either 31 or 32, only one primary code we need to use. Up to 2.5 centimeter, 31.
Yes, sir.
Okay, 13131 should be primary up to 2.5. Then 2.6 to 7.5, another primary code we have. Two primary codes we should not code. 3, 2. We need to use. So option D eliminated. First we can eliminate. Then check A, B, C. Here they given 4 times, correct?
Yes, sir.
Eliminated. Then here they given 13133 three times and 33 again 52. No
Yeah.
need to append any reduce service. Only option
Yes,
C
sir.
correct. Got it?
Yes, sir.
Who said D
Yes.
in WhatsApp texting? That should be wrong. Now you can understood. Okay. No need to code 3132. Okay. Wa?
Yes, sir.
Option C correct. Next one more question. Seventh question.
Engineering closer between the dots. That more. Yeah. First, we will use in 59 modifiers, sir, because they are different procedures, simple and intermediate. So option A and D eliminated. Yes, sir. Yes.
C is the answer.
C, sir.
C, sir.
C is the answer, sir.
Yes, sir.
Very good.
So yes. So I will share now 40 questions with you. While
Okay, sir.
we are doing that 40 questions, it was completely 1 to 6 series range. Use
Okay,
your
sir.
knowledge. Okay. Do not go with directly code. Read the below the parenthesis, whatever they give in the bracket, and read the definitions above the concept. Okay. Then you will get the code idea. Okay. So after
Okay, sir.
completing, tell me, I will share the answer key with you. That 40 questions. Clear?
Okay, sir.
Yeah. Okay, guys. Thank you. For having
Thank you, sir.
doubt in the deployment, last